Good afternoon, North Dakota. Welcome to today's coronavirus press briefing. Before we get to today's case count, I want to walk through some other data which might be useful for all North Dakotans as we think about where North Dakota stands in our battle against this deadly virus. The first thing I'd like to take a look at is North Dakota positive test case rate. We know that in states where they've got dealing with shortage of hospital capacity and rising death counts, that's correlated to a high percentage of positives. In the case of the states that we all, our hearts go out to those states that are dealing with this right now, but whether it's the New York metro area, including New York and New Jersey. New York's at about a 40% positive of people testing positive out of all the tests taken. New Jersey, 46%, Michigan, 34%. Louisiana is also climbing. But here we are in North Dakota with a 3.1% test rate, and we're the third lowest. Only Alaska and Hawaii, which have got also some natural geographic advantages the way North Dakota does, put us in that spot. So that's good news in terms of where we are. It means we're still early in our battle. Every state will likely hit a point where there's an increase in their curve. We're not there yet. So for us, we've got a longer march ahead of us. We've stayed at this rate between 2.2 and 3.2% on a rolling average over the last 3 weeks. But on every given day, it may bounce around a little bit. And we know that if you run the numbers for today, the positives today relative to the test today, it's at 4.2%. It's not a cause of major concern, but we're going to continue to track this number closely, which is the number of the positive rate per testing. And then others might say, well, maybe you've got a low positive test rate because you're not doing enough testing. But in fact, as we know from those who've been at these briefings for the past 3 weeks, North Dakota has been committed to being on the front edge of testing, and we continue even as the nation pours resources towards the hot spot in terms of testing resources. We are one of the states that's done extremely well in terms of testing that's overall, we're the 10th best so far in terms of tests per capita, almost 9 per capita, and we're really leading among those states that haven't had a breakout. Now, when we take these two together, the number of percent of positive cases and the amount of testing, you'd want to be in the upper right-hand quadrant of this graph, which is where North Dakota is. The higher you are to the top of this graph means the lower your percentage test rate. So only Alaska and Hawaii are states that are closer to the top of this graph. States that are to the right of us on this graph include states like New York, where an enormous amount of federal resources have been supplanting the state effort to try to get as many people tested as positive. And so this is again reflects that we're in a good spot today, and it means that we've got good information to help guide us. We don't have perfect information. The data on testing is always lagging. There's a lot of uncertainty that's out there, and we know that the virus continues to spread in our state. We know how it spreads, and so we've said all along that we're well positioned, and we've got more time to continue our preparations so we can be well positioned and well prepared so the public can have confidence in how we're approaching this. But it doesn't mean that we can take our eye off the ball in terms of our strategy, in terms of what we're trying to accomplish in terms of saving lives in North Dakota. The test numbers for today, there were 18 positives for today that came through out of 426 tests. We'll include in a minute some of the updates of our drive-through testing that we did in rural western North Dakota this past weekend. But what this information does do is take us to a number which people tend to focus on, which is the 225 confirmed cases. But on this slide, I want to make sure, again, we're also focusing on the sort of the lime green, the recovered portion of this, because when we net out those that have recovered off of this list, we get a smaller number, and that's something that we want to also pay attention to in our reporting, because in terms of our healthcare system, which we're trying to protect, we're only managing the active cases. As far as a strategy, again, a slide that everybody's familiar with in terms of flattening the curve, and we're trying to two things, trying to flatten the curve, and we're working to raise the hospital capacity. When we keep those two lines apart, the area under the blue, keep that flattened down, and the green line on this slide, keep that moving up, which we're doing. Then we can assure that we can provide the best possible care for the most number of people, and that's what's going to allow us to save lives in North Dakota. And when we talk about slowing the spread, this is what we're doing. We're slowing the spread. We're not eliminating the virus. We're just slowing the spread of the virus. And when we slow the spread of the virus, that means that, again, our curve is flatter, but it may mean that some of the restrictions that we have may be also have to be in place longer. But one of the key things we're trying to really keep an eye on, because there have been a lot of calls for us to be more restrictive in our guidelines or in our mandates. And one of the key things we want to make sure we're managing, because the key way for all these strategies, the strategies of slowing the spread, and then the mitigation, and then the containment. Well, the key thing is, in the end of the day, is hospital capacity. And we have shared some of those numbers before, but we wanted to, again, really highlight for all North Dakotans, for everybody to understand that, yes, of the cases we've had, 32 of them have required hospitalization. Only 19 of those are still hospitalized today. And we're working to really nail down the exact numbers in terms of hospital bed capacity in North Dakota across 3 tiers, Tier 1, Tier 2, Tier 3, which would take Tier 1 and Tier 2 would be hospital capacity that we could. Tier 1 is what's available today. Tier 2 is what is available within the existing walls of our medical facilities when we convert every possible space to hospital use. And Tier 3 is when we would get into the field hospital situation. But just in Tier 1 and Tier 2, there's a strong understanding that we could get to 2,600. So if I can pull that slide back up again on the hospital beds, 2,600 beds, and we are using 19 today. Again, for everyone to take a breath and understand that if what we're trying to manage against in terms of hospital capacity, we are clearly one of the states that remains in the very best position, because you do these two numbers, 1% of 2,600 is 26. We've got 99% of our potential hospital capacity still available in our state if we had to pull out every stop and use every single bed for COVID. So far, we're again well positioned. One thing, sadly, in today's report, we did, since our 11 o'clock, all these numbers are through the 11 o'clock to date. We're going to continue to report for the prior day. So these are Sunday's numbers reported as 11 o'clock this morning. But since 11 o'clock this morning, we have had a confirmation. The family has been notified. So we're sharing today another death that will be included in tomorrow's numbers. The man was in his 70s. He was from Emmons County. He acquired COVID-19 through community spread. He had underlying health conditions, but of course, from the First Lady and myself and all of us here at Team ND, our hearts go out to his family and friends and all that knew him for the loss of their loved one. In the weeks ahead, we're going to talk more. Days and weeks ahead, we'll be back up here talking in more detail about our hospital surge plan and the 3 tiers. So you'll hear more about in the coming days. Our team worked diligently, multiple meetings on Saturday and Sunday, both at the state level and with our providers around the state, to make sure we've got a coordinated and thoughtful plan when we start to get to that point where the cases are climbing, that we're going to be ready to deliver a healthcare response. To do that and to make sure that we keep our great progress going, we have to make sure that we're really following all of our ND Smart recommendations. And of course, that's about staying home, staying healthy, and staying connected. When you take a look at the CDC or the White House recommendations, which we've adopted either as guidance or as executive orders, recommending that everyone in the state follow those, which again, we want you to avoid crowds and social gatherings of more than 10 people. I want to just take a double click on that. We continue to hear anecdotal information from around the state of gatherings, whether it's house parties, whether it's church services, whether it's other informal gatherings where people are not taking that limit seriously. We want to make sure that that people do. We'll continue to monitor this with input from mayors and county commissioners and the public. Other states have gone to executive orders to turn that into a mandate. We're again asking the public and public leaders to reinforce the message about the importance of this to stop the spread. And I know that people are well-intentioned in terms of their gatherings, but whether it's for social purposes or something that you might think is incredibly important, I know many families have had to make the very, very difficult decision of postponing funerals. But as I said, one of the big hotspot outbreaks in Eastern Canada came from a group of people that all attended a funeral, and so we have to be careful. We have to think about the cultural challenges this presents for us, because whether it's Scandinavian culture, tribal culture, all the different diverse cultures in our state, at times of need is when people want to come together. That's when they want to be with each other. They want to give each other a hug. They want to support. You want to bring over the hot dish. Someone's ill, you want to come and visit them. That's what we've always done. And again, part of that culture we have to resist, because that culture doesn't match up with how rapidly this virus can spread and how contagious this virus is, and how this is deadly, particularly for people that are elderly with underlying health conditions. As we've said, this is not the flu. This is 15 times more deadly for people with underlying health conditions, which include diabetes, heart disease, obesity, other chronic health diseases. This can have a higher mortality rate. And again, as we've gone through, we're not talking about a few people in North Dakota. We're talking about over 20% of the population of North Dakota would fall into that category of the few folks that are considered most vulnerable. Another is washing your hands. Again, I know that people have become better at washing their hands and disinfecting surfaces. But again, if you're saying, hey, I'm out doing essential work and I'm going to the grocery store and I'm touching a door handle going into that grocery store and 100 other people have touched it, you've got to wash your hands or use disinfectant, or you could be one of the mechanisms of community spread that could literally be passing the infection to someone else, and it may have no effect on you, could be deadly to them. And so again, avoiding travel, no non-essential trips or social visits. We're going to be talking more about visitations to nursing homes today, and regarding or the importance of keeping and protecting our most elderly people. Those of you that are supporting our restaurant community, again, thank you for using drive-thrus and curbside at restaurants. Work from home wherever possible. We know that's not possible for people in our ag community. If you're in spring calving, if you're getting an itch and getting ready, I know it's too wet for most everybody and too early to be in the field, but I know that a lot of the people with agronomy and grain elevators and feed suppliers have instituted very responsible practices, such as when people are coming, they've got their order already set out for them to pick up, or don't get out of your cab when you're going through. If you're dumping grain in the driveway at an elevator, stay in your vehicle. Again, there's a lot of very pragmatic, sensible things that under North Dakota Smart that you can do. If you're a grocery store, other states have instituted executive orders. We're not prepared to do that, because we think that North Dakotans are smart enough to, whether it's having your employees wear masks, whether it's the people stocking shelves wear gloves, whether it's putting tape on the ground around in the checkout line so people stay more than 6 feet away from each other. The plexiglass that's gone up at some of the checkout lines, picking up orders. There's hundreds and hundreds of things that could never be encompassed in an executive order that we as smart North Dakotans can go out and do. So if you're one of the lucky few that is still operating a business today and you're still open and it's deemed an essential business, please do everything that you can to modify your standard operating procedures to protect your employees and the public. This is more effective. Again, this is about, individual responsibility means, employees speaking up if they think they're at risk. It means business owners looking after their team members. It means customers giving feedback, and it means everybody doing their part to minimize travel and stay at home wherever possible. One other thing which we've talked about before is it's still, we know a lot of people have been tested, and they're getting tested in many cases because they're symptomatic. But if you're not feeling well, stay home. If you have family members that are sick, stay home. There's a lot of pragmatic things here. Just if you're not feeling well, do not go to work. That can be one of the number one things we can do to slow the spread, is to have the people that are not feeling well participate in this. And as I've said before, I will use every tool at my disposal and all the powers that are granted to me as governor to help protect the health and the safety of the citizens of North Dakota. But for those that are putting out calls for us to do more, I encourage them to look at the data we're sharing today and know that when it makes sense, we'll take those steps, and if it makes sense, we'll take those steps. But in our judgment as of today, what we're doing, plus the 2 new executive orders you're going to hear about in a minute, put us on that path towards pragmatic steps to slow the spread while we continue to build and expand our hospital capacity. To that end, today, we are going to sign an executive order today, which is going to require individuals who test positive for COVID-19 to self-quarantine. This would be if they're, because again, only a fraction of those people who test positive end up hospitalized. But if you're tested COVID-19, it would seem to make complete common sense that you'd be self-isolating. This is what we've been asking for, but now we're turning this into an executive order, and this will be tied into directives coming from the powers invested in our state health officer. But if you've got COVID-19, you need to quarantine. If you've tested positive, quarantine for no less than 14 days. And we say no less because maybe it's going to be longer than that based on your individual situation. But now here's the other part, which you've heard us say. If you're a family member or another individual living in the same housing situation, the same household, if you're living with someone who has tested positive, you are also ordered by this executive order to self-quarantine for a period of no less than 14 days from the date of the positive test, or unless directed otherwise by the state health officer. Self-quarantining of those people who test positive and those who are in direct contact with those people who have tested positive is the least restrictive and the most practical and most effective way of separating individuals who are known to be contagious or exposed to COVID-19, and it's the most effective way to protect those that are unexposed, susceptible, or vulnerable individuals. So we, again, have been thanking people for their cooperation during this time when we've offered this as guidance, and we extend our gratitude to all those who understand that you're being a hero. If you're living with someone who's tested positive for COVID and you're undergoing that quarantine with them, we say thank you to you, because your actions to stay home, stay quarantined, clearly has the opportunity to save lives. It should be noted that while this may seem restrictive, we had some time ago already put in the 14-day self-quarantine for citizens returning from states on the CDC's widespread COVID list. And from our understanding, that was a lot of people that were here, that were either coming here for summer labor, sometimes from around the U.S. or around the world, is an important part of our farm labor. It could have been people returning, snowbirds returning from Florida, Arizona. We've heard a lot of folks that are in that category of the snowbirds that are gladly doing this as they quarantine here. Even some of them I know probably were self-quarantining in the states they were at before they came here, but we again are grateful for their collaboration and cooperation. Second executive order, which I'll be signing today, we're moving from guidance to an actual executive order suspending visitation at long-term care facilities. This includes skilled nursing, basic care facilities. There are exceptions in this for end-of-life and compassionate care circumstances, but all non-essential services provided in long-term care facilities must also be discontinued until further notice. And this, again, is an obvious way to move from guidance to an order, something we've been providing guidance on for some time, but again, to try to protect our most elderly and most vulnerable. There are many other states that have had deadly outbreaks in nursing homes. There are other states that have got dozens and dozens of nursing homes that have already got COVID positive. So far, we've been very fortunate here. So again, we know that the guidance that we'd provided, that there was high compliance, and we want to thank those family members. We know how difficult it is to not be visiting your loved ones, but we would say, amp up the cards, the letters, the Skype, the Zoom, the phone calls to make sure that, while we may not be able to see them physically, that those that are most vulnerable in a state know how much we care about them. And by putting this order in place, we do this because we're trying to save lives. We also do this with the full support of the Long-Term Care Association of North Dakota, and we thank them for their collaboration as we've worked through this health crisis. This is also consistent with the American Healthcare Association recommendation and our State Department of Health as well. They have continued to support these kinds of actions as well. And so we appreciate the unanimous support for this action. And we will continue to take targeted actions and review those opportunities around the clock and every day, things we can do to slow the spread of COVID-19 and protect those that are most vulnerable. Next topic, I want to give an update on, the very exciting project that we were able to conduct on Saturday and Sunday. And let me just start out with a thank you to all the folks from our Department of Health, those folks from the National Guard that were part of this assignment, all the people that planned it and executed it, and all the people from the local health departments that were there supporting it. But our Operation Rural Drive-In Testing was a success, so successful that it was oversubscribed. This is one of the first in the country, and again, credit to everybody at the state lab and everybody working on logistics. This would not have been possible if we had not been able to build up our testing capacity to where we could continue to test all the people who are presenting as symptomatic at our health facilities around the state, and have the extra capacity to be able to go out and try to do some surveillance testing in 2 targeted areas. And we've been asked, why did you pick these 2 areas? Well, when we picked Slope County, we had a county that had 0 tests and 0 positives, a large county with very low population per square mile, one of the most rural counties in the nation. Between when we picked it and when we announced we're going to execute it, we had our first positive, but we were still going into a largely untouched part of the country, which was part of the testing criteria. And we did have 367 samples that were collected. Originally, the testing was going to go from 10 till 2. It went from 10 till 4:30. Because of the huge turnout, I believe as early as 1:30, we had to start notifying people that were in line. We had a line of cars from the, winding from the Amadon Fairgrounds in through the town of Amadon, and want to apologize to those people that came and waited and were turned away because we didn't have enough tests. But we tested a lot more than we thought were going to show up. So again, good feedback for us that there is widespread interest in these drive-through testing, and 367 samples. Most of those collected from Slope County citizens in a county that's got about 750 people will give us a really good statistical sample of and lens of what's going on there. Some of those samples made it into today's count. We're going to have a full account by Wednesday of the testing from both the Gladstone, North Dakota Fire District and the Slope County area. Again, want to give a shout out to Slope County Emergency Manager, Slope County Commission, and the Slope County Fairgrounds Board, and everybody locally that helped make this thing possible. And again, I think very positive. One of the things that this also allows us to do when we collect these is to us to be able to validate, which we have been able to confirm, that the oral swab testing that we were doing on Saturday is working on the new large high throughput Abbott 2000 M2000 Abbott machines. We received 2 of those last week. We were one of the few states in the country to get an allocation of those, and excited to see those up and running and helping drive this. On Sunday, April 5th, the second drive-up test was held in Gladstone, North Dakota. And people might know that that's in Stark County, east of Dickinson. This is Stark County and Montreal County are the 2 counties that actually have got a higher percentage of positive cases per population than even any of our other metro areas. So if we were going to say, you know, do we have any hot spots in North Dakota? 2 places we've got our eye on is Stark County and Montreal County. Again, that was meant to go, you know, on Sunday afternoon, and it went from 1 p.m. to 5 p.m. 368 samples were collected on Sunday. So the team North Dakota collected 735 samples. It was free for all participants. One of the things that we are going to come up with this is, because there was this little bit of screening, is we're going to see if anyone who tested positive was someone who reported coming into that test that they had no symptoms, no fever, no cough, no respiratory illness. We will, again, help us get visibility, and this is data that could help really shape our models, not just here in North Dakota, but the models of this country, and we want to continue to try to identify that information. The faster we can identify for someone that's positive, so if someone is identified as asymptomatic, but they're positive, the quarantine order that we just announced still applies to them. Because this is probably where we've had some issues, is where people are asymptomatic, meaning showing no symptoms, but they're spreading it unwittingly. So again, that's a key thing that we have. And again, we were able to get 188 of those tests from Saturdays have been concluded. 94 of them made it into this morning's report, and the Public Health Lab announced that we'll have all these on Wednesday. So again, great collaboration between local public health, Department of Health, North Dakota National Guard, local first responders. Want to give another shout out to the community of Gladstone, the Gladstone Fire Department, Stark County Sheriff, who also provided a bunch of support to make this happen. One of the things that I want to say, which has been undetermined, but I'm going to throw my own opinion in here about where we should go next. Had conversations with Chairman Mark Fox today and Dr. Monica Meyer. Dr. Meyer is the councilwoman for the north segment of MHA. She's the former chief medical officer for the 5-state region for Indian Health Service, longtime emergency doctor. Within the Elbowwoods Clinic is a place where we have had 12 positives out of 51 tests. So if you take a look at that, you know, that's a situation where we would have a through known contact through some of those individuals, but where we would consider that a hotspot. So I'm proposing this is another area where we may, if we can get our capacity up and get our team mobilized to think about this. We had talked about tribal areas as one of the test areas, and now we've got a potential hotspot that we can collaborate with the tribe. Of course, we'll do this with the support and invitation of Chairman Fox, if he invites us up there to do that. But we had another 3-hour call on Friday night with all of the 5 tribal chairs from around the state, State Health Officer Mylan Tufte, myself, Scott Davis from Indian Affairs, continuing to collect valuable information about the unique challenges that we're facing in Indian country, and want to work with our neighbors and our partners in those sovereign nations to make sure that we're doing the very best in collaboration to help support them as well. Okay, on next topic I want to talk about is behavioral health. There's a enormous focus on this virus right now, and the virus is about physical health. But we have to understand that there's something else going on right now, which is, again, with the kind of isolation, with the disruption, whether it's, kids not seeing their schoolmates, whether it's parents breaking out of a routine. If you've been someone who's gone to work faithfully for the last 30 years and now you're not going into work, if you're someone who's recently been laid off, if you're a small business owner and you're wondering about your financial concerns and how your business is closed. If you're a farmer that was already under enormous stress because of last fall's flooding, let's just say we know that the amount of stress hitting the people of our state probably has never been higher. If there was a stressometer, that was showing the dial, it would be at levels we haven't seen. And we have to understand that stress is directly related to health issues. So taking active measures to try to reduce your stress, whether that's exercise, whether it's meditation, whether it's connecting with family, whether it's fresh air and outdoor activities, whether it's more sleep, whether it's being more kind to yourself and creating space for some self-care. All these things that we may not be used to be doing in a world that was North Dakota tough. We've talked about, people that get up and go to work for 50, 60 years, no matter how they feel. Doesn't matter, I feel bad, I got to go do my work. That's part of what's been core to our culture. But to get through this pandemic, it's an opportunity for all of us to learn new approaches. There is a national distress helpline. We're showing the number here, the 1-800 number. You can text to talk with us at a specific number. That's being shown, disaster distress website. We're going to push all this out here. This is a national resource that was created in 2012 following Katrina. It's been used, everything from rolled out with a lot of usage after the Boston, bombing, after the Ebola crisis, et cetera. But when you call this line, you're going to get connected with counseling, trained counseling and support, and those individuals that you're going to talk to. It's a network of crisis call centers across the country where the calls get routed. And when you call or text, they're going to listen to what's on your mind. They're going to do it with patience. They're going to do it without judgment. You don't have to give any identifying information about who you are, where you live. But if you need somebody to talk to and you're sitting at home isolated, even if you're just concerned about what's going on, go ahead and call this disaster distress hotline. They're there to help. Next topic. This morning we had a 2-hour call with all the governors of the United States and the vice president and all the leaders of the coronavirus task force, whether it's Pete Gaynor from FEMA. We had the Admiral on there. We had Dr. Bricks was on board on the call. Secretary Treasurer Mnuchin was on board, and governors from around the state. And the key messages from that call are what we've already covered today, which is asking all governors to reinforce the need for us, particularly during this time, to follow all the guidance that we have. And for North Dakota, that means all the executive orders plus all the guidance under the North Dakota SMART, the stay home, stay healthy, stay connected guidance that we're providing. Another thing that they announced was that the federal government had purchased 1,200 of the Abbott ID Now machines. These are the machines that can do a test in less than 15 minutes. 15 of those are going to each state. So that's fantastic that they're distributing those to the states. They're expected to arrive between April 7th and April 10th. They had purchased 1,200. The other 450, which I'm happy to report, are going to Indian Health Services. So Indian Health Service will be receiving nearly a third of that allocation, or slightly more than a third of that allocation, which again can filter through and be helpful to the tribes in North Dakota. The other topic from Secretary Mnuchin, again, I would encourage everybody out there, if you're a small business, a sole proprietor, individual booth license owner, if you're a gig worker working from home, and you may not think that some of the programs that were announced in the CARES Act apply to you, but we want everyone, again, this is an opportunity for self-responsibility, particularly if you're at home. We said on Friday that this was on a first come, first serve basis, because maybe there's more funding coming later, but there's a cap on some of these things in the hundreds of billions of dollars, so there's still availability. But amazingly, Secretary Mnuchin said it went up on Friday, the SBA thing, $40 billion of applications have already been applied for, and $60 billion of applications were in process. So I can't stress enough that if you're feeling lost and not sure what to do and worrying about your business, if you're an entrepreneur, get online, get on the SBA site, read the rules, figure out if it applies to you. If you're not sure, read the frequently asked questions that are on the SBA site. If you still aren't sure, check in with the North Dakota Commerce Department and see if we can help you. But start first with what's on the line and start filling out your application online. The SBA stuff touches over 50% of our nation's economy. And so again, really want people to dive into there. Secretary Mnuchin also indicated that the direct payments that are coming out, that those are going to start flowing later in this month, and again, those go to $1,200 to everyone who's income qualified, meaning below $75,000 in annual income on your tax returns. There's higher amounts for couples that file together, but $1,200 for each adult, $500 for each kid. Family of four, that's $3,400. You don't have to do anything for that right now, because if you've been paying taxes, you'll be getting that check. If you haven't been, there's still a way to get a check. Information will keep coming on that. And then the unemployment insurance, which we know continues to climb. We had another 2,787 unemployment claims filed over the weekend. That brings the total to 37,794 since March 16th. We're closing in on 2 years worth of unemployment claims in under 3 weeks. So that's that. But the unemployment, the Secretary Mnuchin made the commitment again this morning that the federal government would make sure that the money was there to support that additional $600 a week in federal support. Seema Verma was on the call this morning, who leads for the nation everything related to Medicare, Medicaid, and all the complicated rules that are there. They're complicated under regular times, but again, as new guidance comes out, there's lots of new flexibility, and this new flexibility might be something that cuts through red tape, and some of us that would be opposed to bureaucracy and for entrepreneurship and flexibility and innovation would welcome some of this. The silver lining of this crisis is shedding some of that bureaucratic cost, particularly when it comes to healthcare in America. But hospitals and nursing homes there's a concept that's included in the new rules called hospitals without walls, nursing homes without walls, meaning that if you need to provide care to somebody outside of your physical location, let's say that somebody says, hey, we get in a step down situation and we can't move them to a nursing home, we're going to move them to a dorm, we're going to move them to a hotel, we're going to provide care for them there. The hospital can bill for it even though that activity is not happening within their walls. And so again, encouraging all of the healthcare providers in long-term care and in direct care to really stay on top of all the new rule changes, because the opportunities for billing in terms of how you get reimbursed for this are substantial. And of course, there was $100 billion in the CARES Act going direct to hospitals, and some of that includes, I know from the calls we've had, that hospitals have said that they've got cash flow issues. Some of this allows the new rules that are coming out that we heard about this morning would allow a hospital essentially to get prepaid or get an advance for 3 months of what their normal billing would be for federal. So that could be another injection of cash flow that keeps keeps our healthcare system rolling. So I'd say to everybody that's under economic stress, we understand, we're empathetic. We also would encourage people to take action. You always say control what you can and don't worry about the stuff you can't. One of the things you can control, if you're in healthcare or if you're in small business, is you can control the energy and the time that you put into understanding the new rules and getting your applications in, so to make sure that you're working to the advantage of your team members, and to North Dakota to make sure that if you qualify, that you're getting all that support. With that, that concludes our formal report, other than I want to share a word of gratitude again for all the progress that made. I've been able to share gratitude for all the people that were involved in this weekend's Operation Drive-Through. I want to say thanks to all of the legislators around the state that keep providing us input and guidance. I want to thank all the mayors that Brent and I probably each spent 20 hours this weekend on phone calls, talking to local leaders, and again, a lot of great local leadership that's going on around the state. Thank you to all the local leaders. And for the faith-based leaders, again, we know that yesterday was Palm Sunday. This is the beginning of Holy Week. We know this is a very tough time for not to be together as a congregation, but for those of you that found a way to virtually hold services and stay connected and dealing with the spiritual needs of your congregations, to be able to do that in a way where you weren't in a congregate setting, we say thank you to all of you. And again, for all the frontline health workers around the state that are taking care of patients, for all the folks that are and family members that are supporting people that are sick, and for all of you that are self-isolating, whether you're snowbird coming back to North Dakota, or whether you're someone that has been self-isolating or someone that now falls under this order, we say thank you to you. We're grateful for your actions and everything you're doing. Collectively together, we're helping to save lives in North Dakota. So thank you all, and now we'll stand for questions.
I'd like to go back to the number of beds that you mentioned there. I'm just wondering how many of those 2,600 beds are normally taken up by people with non-COVID related illnesses, and then is that 2,600 number aspirational at this point, or is that the actual number we're operating with?
The aspirational number is actually higher than that. We think that that we can get substantially higher than 2,600 with what we call the surge capability, and that would be adding or converting facilities that may have been closed in the last couple of years, that we could reopen those, whether it's a floor, whether it's a building in a hospital system, but we could get substantially higher than that. That number does not include any of the field hospital preliminary planning that's gone on, whether that's Fargo Dome or University of Mary or wherever it is. I mean, it doesn't include any of that. Licensed bed number in North Dakota is actually higher than that. Your question about how many are used typically, that number is available through the hospital association, through the reporting, but it's really not relevant right now because we've seen such a decline in hospital usage. I mean, what we've got going, I mean, so many cancellations of elective surgeries, so many people opting to not go down. There's been demand destruction everywhere. When I say demand destruction, there's demand destruction for gas and oil because people are driving less, but there's been demand destruction in healthcare, so we've probably never ever had as much available capacity as we do right now in healthcare, because the number of beds that are unoccupied currently is dropping faster than the number of COVID patients that are coming in by a lot. And so to the point where we've even, I'm sure we're going to see in some cases, before we even get to the peak, you might see health organizations even furloughing or reducing staffing levels of some of their staff, because if you're not doing if you're a surgical center and all you did was day surgery and you're not operating right now, I mean, that's freeing up staff, it frees up capacity.
Just a follow-up to that, do you know the latest number on the number of unoccupied beds?
Don't know the latest number, but it's let's just say we got plenty of space right now. We're moving towards getting all of that automated as part of our systems because we want to be able to have essentially a air traffic control tower where we know where everything's available, where it's available in the state, and we want to, ideally we'd get to online real-time reporting on all this information, and that's part of what the Hospital Surge Task Force is working on. One of the action items over the weekend is we've got to add some IT people to that from a data collection standpoint so we can track all this. Dave Thompson, and then to Jacob.
Just a hypothetical. You mentioned about first come, first serve, about some of the benefits from the CARES Act. A, do you think eventually the money will run out? And B, if it does, do we need a second CARES Act?
Will the money run out? I think demand will exceed supply in terms of what the federal government has put into those plans. And I think that the mood of the country right now is that there will be a fourth stimulus bill, and some of that may include components that weren't covered, and some of it may include additional dollars getting behind programs that are working.
Is there anything that you'd like to see in the fourth stimulus bill that is not in the previous three? Well,
there's entire industry segments that were left out, and understanding that how critical industries are. It was great that airlines were covered. I mean, that's strategic, but when I take a look at the energy industry and how critical that is to the recovery of this country, that's one that I think would need to be there. I think we're going to have to take a special look at agriculture as well in terms of how that may have disrupted their supply chains and markets. But I think those are two industries that really weren't touched by the first three rounds. Jacob?
Governor, when you talk to other governors and the vice president when discussing how to reinforce a lot of the social distancing initiatives, is there ever a point where the public can't necessarily be trusted to enact social distancing policies and you have to expand those orders?
I think that what's missing for every governor is the actual data on whether distancing is occurring. I mean, you can compare side by side, here's a stay-at-home order, here's a shelter-in-place order, here's business closure restrictions with executive orders and guidance. I mean, and one of the great things about our nation is that we've got 50 states and that we've got 50 platforms of innovation. And when we get done with this thing, we're going to be able to look back and say, maybe after the fact, what worked and what didn't versus, and I think it's a beautiful thing. I mean, some people are calling for, a federal response to everything. And this flies in the face of, the understanding of your own local demographic situations. It flies in the face of, understanding local capability. It flies in the face of culture. What's needed in Alaska where, the governor was on the call this morning reminding people that he's got some communities that are, 500 plus miles away from the next community and there's no road between them. I mean, those needs are, they're different. Tribal communities have different needs than non-tribal communities. So, it's like one of the beautiful things is that we've got, every governor in the nation cares deeply about their people, and every governor is acting in the best interest of their people. I am really thrilled that we have a approach which is state managed, locally executed, federally supported. That is said on every call that we have with the president and vice president. State managed, locally executed, federally supported. It's not the federal government's job to take care of every, make sure that, every playground in the nation doesn't have more than 10 people in it. And it would be impossible for them to try to do that. So I think the balance and the beauty of America is partly the way that we're set up right now, and I think that we're uniquely suited to use innovation to try to get through this. So I think what's missing on this question, because you can compare what the states have done, but you can't actually compare whether they're working. Because someone can have a stay-at-home order with a list of exceptions that's so long that it's actually meaningless because everything is essential, or someone else, in North Dakota where we may have a less restrictive so far on it, but we may actually have higher compliance. I mean, we're going to be releasing going ahead more data that we're collecting from DOT. We got 77 sites around the state where we're collecting traffic data. We have some places where we're down 50%. Over 50% of traffic. I mean, and if you think that healthcare and agriculture and energy are all essential, industries, and those are our three biggest industries in the state, and traffic's down 50%, I would say the vast majority, I don't know what the number is, but the vast majority of North Dakotans are ably and earnestly and with care in their hearts complying with what we're asking. We're always going to get anecdotal information, on social media that, hey, there was a, house party here and somebody had church there. But I think, for the vast majority of the state, we got people complying. But we're asking people to take it even more seriously, particularly in the weeks ahead. This is when we can really make a difference on keeping that curve flat in the next few weeks.
On a follow-up on that then, since we don't necessarily have the data to know whether or not social distancing is working, what data do you rely on to see how other states are responding and if they're successful?
Well, I think that the data that we do have is the stuff we led with today, which is what's our percent of positives and how are we doing on testing. And if we can continue to lead the nation in, being in the top 10 of people that are getting tests done per capita and have the lowest positive rate, then you'd have to say, hey, if we have a low positive rate, that means that the thing is not spreading. The other thing we look at is, hospital capacity. All the restrictions to slow the spread, the strategy behind restricting, activity in business and travel and contact is to preserve hospital capacity. And as we said, right now, we've got enormous hospital capacity. So against the strategy that we're operating against, that's the data. The data is, net new hospitalizations, is net new, meaning how many are coming in versus how many are leaving, how much can we grow our hospital capacity to, and what's the positive growth. Those are things that we're absolutely looking at. Cases per day, we could have more cases per day than someone else, but if we're doing twice as much testing, that's not really meaningful. We got to look at tests per capita and positives per capita to really compare those numbers state to state. Because if we have more positives in another state, but we've done twice as much testing as they have, then that doesn't mean much.
Follow up to that.
I'm thinking here that this is during a pandemic is when for all of us that hated statistics, maybe you wish that everybody would have taken like 3 more classes. But actually, I didn't hate statistics. You guys probably know that. But I'm. Everybody knows that. But anyway, we are just saying that neither does Brent. Brent loved it. I think he got an A+ in statistics. But anyway, there are certainly math epidemics, and one of the things that you're seeing was talked about this morning on the call in Europe with Spain and Italy starting to show some decline in their growth rates of deaths and new cases. When that's happening, that's influencing the models in the United States. I mean, some of the inability to predict in the U.S. was that in Western democracies, because you kind of had to toss out South Korea and China because they had different abilities to lock down and control how they were managing it. But if you look at Spain and Italy as more parallel from a Western democracy approach to it, and yes, there's differences in demographics because Northern Italy, there was an older population with a higher degree of underlying health issues. You have to factor all that out. But now that those curves are starting to flatten a little bit, that will start to influence some of the models in the U.S. because we've got a lens looking ahead of when that curve would come down. Lane, and then we'll go to online.
Governor, you mentioned earlier that some people have reached out to you to put more restrictive measures in order. There is an online petition right now with over 4,000 people suggesting that North Dakota goes into a lockdown. Your thoughts on that?
Well, aware of that, and there's no way of sorting how many of those people live in North Dakota. I know there's been a lot of out-of-state pressure based on information that's floating around that may not understand that North Dakota was one of the ones that moved early. I mean, I don't know, find another state that closed their schools after they had one positive case. That was North Dakota. I mean, we moved early and fast on a number of restrictions that is producing this low positive rate today, and we've moved fast on increasing our testing. So I feel comfortable where we are. North Dakota's got 760,000 people. Even if 100% of those people were in North Dakota, that would mean that less than close to 1/2 of 1% of North Dakotans signed that petition. I think so anyway, we listen. We get to listen to both sides. We get to listen to people that think we've locked down too much and people that think we need to lock down more. But we would invite those people that have signed that petition to really dig into the numbers with us, be curious about what we've done, and try to understand that what the problem we're trying to solve. And the problem we're trying to solve is to make sure that we save lives. We save lives by slowing the spread and staying under our healthcare capacity line, and we're doing exactly that. So if they've got suggestions about how we can do that better, we want to hear that. But the label on top, I mean, a quote, stay-at-home order, they go read other states' stay-at-home orders and read the list of exceptions and compare those things. I mean, it takes complex problems are not solved with labels. They're solved by a deep understanding of the complexity, and it involves a lot of nuance underneath it. And so, I appreciate the passion, the connection. I appreciate everybody on social media with the feedback. We welcome hearing people's opinions, but our job is to look at the data and listen to all sides. So we're going to keep listening to that, and what we hear on social media will be one piece of that feedback. From online.
Jean Schemp with Hometown Radio Group in Minot and Bottineau. What is the penalty for people who do not follow the quarantine order that you talked about today, and for those in household who might not follow that?
I'm going to do ask. What's they call it? Ask a friend. I didn't watch much TV growing up, but or even in life. But is this a
Class B misdemeanor, $1,500 fine.
State Health Officer Mylyn Tufte says Class B misdemeanor up to $1,500 fine, and that's enforced locally. Another question online.
Robin Travers with 660 KEYZ in Williston. Are there any plans in North Dakota to enforce the use of masks in public areas such as grocery stores?
Question from Robin about enforcing use of masks. Not at this time. I think, as people know, the CDC has recommended this. There's videos online. I think the CDC, the Surgeon General, have got things. If you don't have a mask, here's how you make one out of a handkerchief or a T-shirt. I think that people should, if they want to follow CDC guidance, they should do this. We know that many local cities are taking this action, say with bus drivers, driving public transportation. Masks are a good idea to slow the spread. It's a good idea. So if you're in a spot where you think you're going to have close contact with people, if I was working as a checkout clerk at a grocery store, I'd be wearing one. And so I think, again, it's situational. Wouldn't need to be wearing one at home if you're within your own pod of people. You don't need to be wearing one if you're walking in the park and there's no one within 1,000 feet of you. If you're a farmer, rancher going out by yourself to do your work and only seeing family members, again, the spread that we're trying to prevent is under 6 feet. So if you find yourself in a position where you're within 6 feet of a lot of strangers as part of your work or part of your day, mask would be a good additional secondary measure. And even if you're healthy, it's a good idea. It helps protect you, but you may be asymptomatic. It would stop you from spreading. So masks are another tool, but you order 760,000 people to wear a mask. All we'll do is create a shortage of masks, and then the people that might really need to wear them aren't getting them. So again, we're trying to be, under this individual responsibility. If you're one of those people that you think you might be spreading or think you're at risk, do it. If you're one of the people that's not within 6 feet of people because you're working from home, you're with your family, you don't have to do it. So we've all been given the ability. We talk about individual responsibility, but during this period of time, this is a chance for us to exercise your own judgment. And again, we support people wearing masks. There should be no stigma around that. If you see somebody wearing a mask, the first thing you might say to them is thank you, because they might be protecting you as well as themselves.
A follow-up to, I think, Jacob's question. Do you think a stay-at-home order in North Dakota would improve social distancing? And let's take Minnesota's order in this case, just for the purposes of this question.
We're not the question is a hypothetical one. Do we think it would improve compliance? There's no data that shows that places with stay-at-home orders are having less transmissible contact than states without them. I mean, because there's no way to show that there are fewer people within 6 feet of each other in a state that has a stay-at-home order than there are people that don't. I think there's a presumption that there is, but there's no data that would support that. And so you're, and again, if you're in a large metro area with where a huge portion of the population might be using public transportation, and you've got rates of, these rates of positive testing north of 40%, then you'd be like, wow, that is that's a tool that we need to go to. But when you're in a state that's got 11 people per square mile and 3% rate, and a high degree of compliance with the guidance that we have, again, in some kind of a Big Brother Mission Impossible world where you could track every contact with every other person, we might show that we're having less transmissible moments of under 6 feet than in the States. I'd love to have that rank, because if then you'd be like, okay, wow, we're not doing well on reducing transmissionable moments, we got to do other things. But as soon as you put one of those orders in, then you have to define what's essential or not essential. And talking to every other governor that's done that, I mean, if you don't have that list, then why put an order in? And then if you say, well, we're going to concede to everybody that everybody's essential, then you've effectively done nothing but a kind of a feel-good, check the box thing. And we're actually interested in doing things that actually work, as opposed to just checking the boxes. We'll go online and then back to Lane.
Eric Arndt with KZZY in Devils Lake. Is there any update on the potential plan you had mentioned last week to set up a system making hand sanitizer more widely available?
Eric asking about the hand sanitizer. I know that production of hand sanitizer is progressing. I think I said last week that it was being done by distilleries, and I've heard since then that there may be some ethanol plants that are getting involved. Looking around, is that true? Not true? We don't know. Okay, now I'm spitballing. That's what they tell me not to do from up here. So we'll get back. Eric, we'll get back to you on that one. We'll maybe have an update. We can have an update tomorrow on the mass production of hand sanitizer. But again, the same thing, same guidance we gave last time. If you have an empty bottle, pump bottle from hand sanitizer, hang on to it, and so that, because could have a lot of hand sanitizer, but no dispensers to put it in. So save yours at home. Lane Hinkins.
Governor, a lot of states are vying for medical supplies right now. Has North Dakota had any troubles getting those?
No, we haven't. And I think it's been shared that we shared some masks with Montana to help them out. We had a South Dakota lent us an extractor for a period of time, which we'll get back to them if we need an extractor as a component that goes onto a testing machine in the lab that allowed, they had a spare and one of ours was broken. We had a call on Saturday with Governor Mark Gordon from Wyoming, Steve Bullock from Montana, and Christine Ohm and myself, just the four of us on the call. And we agreed, again, I want to say, like, I get a little emotional. I think about my hometown. I think about, growing up in a town like Arthur, if somebody during harvest, had a heart attack, all the neighbors came and helped make sure that they got everything harvested, took care of it, checked on their family, did all that stuff. This has been going on in North Dakota since statehood. Neighbors helping neighbors. I mean, tribal culture in North Dakota is more about giving than receiving. I mean, so we've got a deep heritage in our state that supports that. And I think it was terrific to be on the phone with our neighbors, Montana, Wyoming, and South Dakota, 3 states that I hold in high regard, 3 beautiful states, 3 beautiful neighbors, that everybody on the phone, the governors are like, look, if we can help each other out directly, we don't need to be, all, waiting for the federal government to come when we can help each other out like neighbors in a small town did. And I think it's already happening, and we'll continue to see that happening. And I think it's another reason why it's great to be in this part of the world.
If I can follow up on that. Over the weekend, I read a few articles from other states about them having low hospitalizations and sending ventilators out to New York since their hospitalizations are through the roof right now. Has North Dakota been a part of that or thinking about doing that?
We haven't thought about doing that yet, because one of the areas where we're probably a little tighter is on ventilators. We got way more beds and bed capacity than we've got ventilators. I know that the state of Washington had received a number of ventilators, like 400 from the national stockpile, didn't need them because they had flattened their curve and sent them back. The Oregon had sent 150 that they didn't need because their peak didn't come as high. And I think that was fantastic and great and wonderful that they're doing that. I think that particularly as we get in-state production, like what's going on at Apario, if we find ourselves in a position where we can be a state that is managed through this in a way where we can help our neighbors, whether it's Minnesota or any other state, we'll be certainly happy to do that. And I think, as has been the past, North Dakotans have always stepped up to try to help other people. We'll certainly do that if we got the capacity to do it. Another question online?
Scott Hennon with WZFG KFYR Radio. How will the data from Amidon and Gladstone be used to shape the North Dakota response going forward, and how many additional drive-through testing operations do you anticipate?
Scott, thanks for the question. On the how it'll be used is, in particular, if we can identify people in those populations. Again, I think we did 367 about approximately at each of those locations. If we can identify people that came through the drive-through and when they did the screening said, have you had a cough? No. Have you had a fever? No. Have you had any aches or pains? No. Have you had, runny nose? No. I mean, if they're have no symptomatics, or asymptomatic, no symptoms, come back positive, that's going to be really valuable information, because we had not been testing anybody in North Dakota prior to this. We'd been testing people that, I suppose the exception might have been some frontline medical workers who had been exposed to a positive that we tested to see if they had contracted it. So if they didn't, they could get back to work as opposed to 14 days of isolation. But in general, we hadn't done any community surveillance to identify whether or not people were people were positive that had no symptoms. So if we can get a baseline and say, wow, in a population of 367 tests coming out of a county with 750 people, and we found a half a dozen people that were positive that had no symptoms, and we can quarantine those people and quarantine those people with the people that they had close contact with, their household members, then we could stop in its track an outbreak within that area, which then saves us all kinds of PPE and saves us hospital beds. It saves us, all kinds of stuff. So that was one. And if we, and again, because there's been such a shortage of testing supplies in the country, the 2 tests on Friday and Saturday are among the first in the country going into an area that had, like Slope County, with almost no reports of COVID, and then doing that scale of testing as a percent of population. And with Gladstone being so close to Dickinson and Stark County being one of our hot spots in terms of cases per 1,000, again, that was us just trying to again understand maybe what the reach and the spread might have been there. So both of those will feed into our models and help us more accurately shape the models that we have going forward. Is there a second part of that question, or did I cover it for Scott?
I think you covered it.
Okay.
I have another one.
Okay, another one coming in online.
Dave Kolpak with the AP in Fargo. Would you say that the calls for North Dakota to be more restrictive are coming more from out of state or in state?
Dave, good question. I don't have explicit percentages on that. We're trying, in some cases on social media, you can't tell if someone signed the petition where they're from or not. We know that some of the calls that we're getting based on the area codes, they're coming into the governor's office, are not 701 area codes. So we know that we're getting out-of-state calls on that. So we're trying to filter those out and trying to really understand who and why people are calling. And again, we found that when people actually understand all the restrictions we have in place, all the work that we're doing, and everything that's going on, then there's a general understanding. And so usually it's but we don't have time to talk to every single person that's calling. But when we've had a chance to, if we got a mayor, we got the doctor from Eastern Montana calls, and Brent and some people call him back. He's like, "Oh, I didn't realize that your thing was so restrictive. You guys are okay. I read online you guys were, no. We've got a lot of things in place that even some of our neighbors don't. So it's a job for us to keep educating and get the word out. But to Dave, I don't know how many are in-state or out-state. If you know, let us know. Thank you, Dave. Okay, we're winding down. We got one over here, and then back to you, Lane.
University of Mary in the Fargo Dome. Do you think any other sites could emerge as Tier 3 sites?
We had identified, I think, 10 potential sites, or the Army Corps of Engineers were here. I know that our team, General Dorman's got the list of those sites. I saw them in a draft plan this weekend. Our fervent hope, we're going to plan and we're going to plan that. Our fervent hope is that no North Dakotan ever has to step into one of those sites, and we don't have to staff them. And if we are smart on executing against the stay home, stay healthy, stay connected on the be smart approach, and if we're great at doing our surge capacity within buildings, taking that available capacity within the hospitals and building that up, we should have enough so we never have to get there. But we said at day one, we're going to prepare for the worst and execute for the best. And preparing for the worst includes having to have these minimal care facilities. No one's going to be on a ventilator in a University of Mary gymnasium. We're not going to be able to deliver that kind of care. But if we get to that level, you could be staffed by, volunteers almost. It could be people that are on a, step down. But we're hoping that we don't ever get to that level of need. And the way we say we hope, we're planning to never get to that need. And the way we do that is the way we stay away from that is everybody in North Dakota following the guidance, following the orders with compliance that we've given about staying home, staying healthy, staying connected. If we do all that, we should never need to set foot in there. But it's our job to prepare for the worst, so we'll keep doing that as well. Lane, Danny, then those are our last two.
Thomas Simon with Williston Trending Topics. The health department says they have 13 ventilators in Williams County and none in McKenzie. What is the state doing to ensure a surge in Western North Dakota has the resources, including ventilators, to handle a surge in the next 3 to 4 weeks?
Thomas, what we're doing is this comprehensive hospital surge planning, the surge planning effort, that team that's working with the private sector with our team from the state of North Dakota includes equipment and staffing, and equipment includes ventilators and PPE and beds, all those things. And so we're going to make sure that we have that. We also, as part of that plan, there's a transportation component, which is either we have to move more resources to where the surge is occurring, or we got to move the patients to where we've got the resources. And that's going to include close collaboration with all the EMS services in North Dakota who typically are involved in transporting patients. But if we have to expand capacity during a surge for more transportation, again, that's where the National Guard can potentially step in as part of providing that transportation. But yeah, every component is being thought of in that surge planning effort. Lane?
In reference to your executive order restricting visits to long-term care and nursing homes, there was 2 exceptions listed on there: end of life, which is pretty self-explanatory, and compassionate care. What would be defined as compassionate care?
Mylene, do you want to offer that, or should we refer people to a website for the explicit definition?
They should talk to their facility that they're going to. So.
Okay, the answer is talk to their specific facility. But good question from Lane at KX News, and we'll get the clarification because we want to make sure that we're not using words that are confusing. So thanks for pointing that out. We'll make sure we get a definition out there of what that means in our order. Okay, with that, I want to go back to, again, gratitude this time to all the press corps that has been faithfully showing up, and to all the people that are showing up online and asking questions online. Your role in helping get accurate, timely information in the state of North Dakota is critical during this crisis, and we're deeply appreciative of each of you being here and being part of this. And we look forward to seeing you again tomorrow at 3:30. And to everybody that is watching online, you're doing your part to help get valuable information out that helps protect you, your family, and your community. Anybody who's watching, you're a hero to us. So North Dakota Smart, stay healthy, stay home, stay connected. Thank you very much. Appreciate it. See you tomorrow.